Hepatitis C is the most common blood-borne viral disease in the United States. It's 4 times more common than HIV. Over 4 million people in the United States are infected with hepatitis C, including many in Clearfield and Jefferson counties. 9 out of 10 people who have hepatitis C don't know it. Could you be one of them?
Hi, I'm Dr. Tuesday Stainbrook. I'm an infectious disease physician here in central Pennsylvania. I treat many people who have hepatitis C. I also try to make people aware of risk factors for hepatitis C and to help people find out if they are infected. Hepatitis C is potentially deadly. It is known as a silent virus because it can be damaging your liver and you may not even know it. You may have no symptoms. However, the earlier you are tested for hepatitis C, the better the chances for a full recovery and a long, healthy life. You may have heard of other types of hepatitis: alcoholic hepatitis, drug-induced hepatitis, or other viral hepatitis such as A and B. You may have even been vaccinated against some of these viruses. But those vaccinations won't protect you against hepatitis C. There is no vaccination for hepatitis C. Hepatitis C is spread from one person to another by blood-to-blood transmission. Today, most cases of hepatitis C are caused by intravenous drug use. If you share drug needles or other paraphernalia with someone who is infected, you may get hepatitis C. Until 1992, you could also get the virus through blood transfusions and certain other medical procedures. Now the medical community can test blood products and organs for hepatitis C. So today, transmission through medical procedures is rare.
You could be at risk for hepatitis C for various reasons. Remember, because you can have hepatitis C without showing symptoms, you could be at risk even if you only used intravenous drugs once and it was many years ago. Here are some of the people who are at risk for hepatitis C: current or former injection drug users, individuals who have snorted drugs, recipients of blood products before 1987, recipients of blood transfusions before 1992, people who had major operations before 1992, chronic hemodialysis patients, people with HIV infection, children born to mothers who have hepatitis C, and multiple sexual partners or sexual partners infected with hepatitis C. You also could be a healthcare worker who suffered a needle stick injury, or maybe you got a tattoo, a body piercing, or even something as simple as a manicure using unsterilized tools. In any of these cases, from IV drug users to healthcare workers, you can get free testing to see if you have hepatitis C.
What exactly is hepatitis C? It's a virus that causes inflammation or swelling of your liver. You need your liver to filter toxins from your blood, things like drugs, foods, and alcohol. Your liver also stores essential vitamins. Hepatitis C attacks your liver, replacing healthy cells with scar tissue. This can lead to cirrhosis, which is when your liver has little or no functioning cells left. About 20% of people who have chronic hepatitis C will develop end-stage liver disease. Hepatitis C can also result in liver cancer. Symptoms of hepatitis C include fatigue, abdominal pain, depression or mood swings, muscle or joint pain, loss of appetite, night sweats, dizziness, mental confusion, and indigestion. If you let hepatitis C go untreated and it progresses to cirrhosis or advanced liver disease, you can expect serious additional symptoms, including yellowing of your eyes or skin, swelling in your legs and feet, fluid collecting in your abdomen, poor blood clotting, and bleeding from the esophagus and stomach. Don't think you're safe just because you don't have any of these symptoms. Hepatitis C can silently destroy your liver for 20 years without showing any outward signs, until it's too late to treat the disease. Liver damage may occur faster in people who also have HIV or hepatitis B, drink alcohol, smoke, are male, acquired hepatitis C after age 40, or have a weakened immune system. For every year you wait to be tested and treated, your chances of being cured go down by 10%. If you're pregnant and at risk for hepatitis C, it's especially important to get tested. Should you test positive, your doctor can take steps to help keep your baby from being infected. Most people think hepatitis C only affects your liver, but it can also damage your eyes, joints, kidneys, and immune system. This can result in anything from arthritis to depression to diabetes.
This all sounds very serious, and it is. Hepatitis C can cause life-threatening conditions. It's the leading cause of end-stage liver disease, liver cancer, and liver transplantation in the United States. However, if you're diagnosed early enough, maybe even before you have symptoms, hepatitis C often can be cured. Doctors diagnose hepatitis C through a simple blood test. You can get tested at no charge through the Clearfield-Jefferson Drug and Alcohol Commission. Technicians there will screen your blood to see if you have certain antibodies. A negative antibody test shows that you have not been exposed to hepatitis C. If your antibody test is positive, the next step is to measure the amount of the virus in your blood. Your physician may also look for evidence of liver damage, such as low platelet or white blood cell counts. The most accurate way to assess liver damage is through a biopsy, which takes less than an hour on an outpatient basis. If you have hepatitis C, your doctor will prescribe medications to fight and hopefully kill the virus. If you don't have hepatitis C, you can help to make sure you don't get it. Here are a few things that can help. Make sure tools are sterilized before you get a manicure, pedicure, or acupuncture. When you get a tattoo, request new individual inkwells and sterilized needles. Don't get a homemade tattoo. Don't share personal items like razors or toothbrushes. Don't share syringes or drug straws. Use condoms when you have sex, especially if you have multiple partners.
Hepatitis C is very treatable and can be cured, but you can't be treated until you know whether you have it. If you're at risk for hepatitis C, contact the Clearfield-Jefferson Drug and Alcohol Commission for a free screening. If you're an IV drug user, if you've injected drugs even one time many years ago, if you have HIV, if you've had multiple sexual partners or a sexual partner infected with hepatitis C, if you've snorted drugs, get tested. If there's any chance you may have been exposed to hepatitis C, get screened. If you live in Clearfield or Jefferson County and you have at least one of the risk factors we've talked about in this video, your confidential hepatitis C screening is free. We have convenient screening sites in DuBois, Clearfield, Coalport, Brookville, and Punxsutawney. Call the Clearfield-Jefferson Drug and Alcohol Commission today at 1-800-892-9002 to schedule your free screening.